So, what to learn to unlearn today? Hi, welcome to Vhealthy Podcast, the space where holistic well being meets inspiration. Today, I'm delighted to introduce Rita, who is a compassionate dietitian and nutrition practitioner on Vhealthy. She holds a degree in nutrition, focusing on weight and disease management through metabolism focused strategies, lifestyle shift, and mindful eating. She empowers her patients to respect their body while building long-lasting, healthier habits, and she speaks English and Arabic. And thanks for joining today.
First of all, hi everyone. Thank you, Vhealthy, for having me on this podcast. It's a pleasure to introduce people and giving them awareness about nutrition and how food can affect our life negatively and positively, physically and mentally as well. So, what you have said is briefly what describes my field and me personally. And I'm delighted to go on with the podcast and talk more about nutrition with you.
What is a common myth about your field that is simply not true?
Well, nowadays, through social media and what we're going through on a daily basis, there are many myths concerning my field, nutrition, or as food as a whole. But I would like to talk about one common myth that we hear on a daily basis is that we hear that carbohydrates make you gain weight. So some people try to avoid and not adding them to their daily routine, whether it's the way in their cooking or in whether they're following a diet plan and so on. I would like to say that we should not be afraid of carbohydrates because carbohydrates are essential in our diet plan and in our daily eating habits because they actually help you burn fat. And this is where people are not familiar with this point that I'm talking about. Now, of course, balance is key, and knowing the right amount of carbohydrates should be known in order to add it to your meals. And this is where the nutritionist or the dietitian plays their role in order to help you know the exact amount of carbs to be added to your meal. In addition to that, you should know and get familiar with the specific kinds of carbs to choose from, such as whole grains, fruits, vegetables, and high fiber carbs to be added to your diet. And very important to know that cutting out carbs can also cause vitamins, calcium, and dietary fiber deficiencies. So you're not only affecting your health, you're also depriving your body from the essential nutrients that your body needs. So this is the myth that I would like people to know, that you should not be afraid of carbs. In fact, it should be 40% of your diet plan. Another common myth that I would like to talk about, and it's a more generalized myth, is about nutrition. That some people, through practice in the clinical and hospital field, I used to hear a lot that eating healthy is very expensive, that going to the supermarket and purchasing healthy items is expensive. I would like to say and point out that you can shop healthy items on a budget. There's a specific way to do this. And the way of doing this is by planning your meals a week ahead and having them ready for you and stored for later consumption. This way, you will be eating healthy and feeling full because your meal will be filled with nutrients. This, in return, will be a positive impact on your body because it will not make you feel the urge to have or to snack on unhealthy items. So this way, you're not spending on unhealthy items and you're spending less. And also, it's very important to point out that your grocery list should be written down with the ingredients needed, because when you go to shop, you will not only be spending on those specific items, you will be also underspending, because when you go to the supermarket and you have no idea what you're buying, you will be overspending, especially on unhealthy things. So in conclusion, write your grocery list, shop healthy, and budget, and this way you will be eating healthy as well.
Thank you for those insightful techniques, and it's great to hear some practices to help build and shape a better health routine, which is also cost efficient budget-wise.
Exactly.
I was thinking, because many times we tend to link a diet with also the weight machine, but I'm not sure if that's something which is quite relevant, especially nowadays. And if we stopped using weight as the primary measure of health, what would it change?
Many people these days are obsessed with their weight. They think that weight as a number is an indicator for health. There are many overweight and obese people out there that are very healthy in reference to their blood tests. So weight gain actually does increase risks for diseases. It's true. But that doesn't mean when you step on a scale and you see weight gain, or whether your BMI isn't within the normal range, your mind shouldn't go straight to diseases. In other words, if you focus on being physically fit, eating healthy, you will notice changes physically and mentally. It's important to have good mental health to regulate your stress hormones, which can interfere with weight gain or even with your weight loss journey. I would like to say, do not think of the scale. That's what I always tell my clients. Instead, I would rather you look in the mirror for changes, even when just trying on your clothes, as simple as that, and notice those changes rather than just looking at your weight as a number. I have to also mention, because this is very important as nutrition wise, that hormones, changes in hormones, to be specific, stress levels and muscle growth can also interfere with your weight by stepping on the scale and noticing no changes. But in fact, physically, when you look at yourself, you actually see a difference. So, to briefly conclude this point, you should eat healthy, work on your metabolism rate with guidance from a nutritionist, be physically fit, and focus on your mental well being. And this way, you will notice your health will change rather than just focusing on your weight.
What would you say to someone who never been to a nutritionist to gain more insight about how does a session look like, how often a person is more advised to consult a nutritionist? Will it be more on a weekly basis, monthly basis? And how do you accompany also your patient? Considering that I understand that nutrition or weight loss, weight gain is also a lot related to emotion. So how do you cope with all those information and how do you accompany your patients?
So first of all, as a start, if the client comes to the visits a nutritionist for the first time, they will be given a diet plan according to their medical history, because it's very important to also treat diseases, not only follow a weight program, whether it's weight gain or weight loss. And according to that, you give an individualized diet plan for 2 weeks as a start. And the follow-up session will be after this 2 weeks. And further, with time, the client can revisit every 3 weeks. But as a start, because you're experimenting their body, and for them to feel they trust the nutritionist for guidance and follow-up, they have to revisit after 2 weeks for the first time. So that if there's something wrong with the diet plan, you can just prevent further damage. You can just change and be on the right track from the first 2 weeks. As for the clients, I would like to say that nutritionists are not only weight doctors or medical professionals, they are also professionals that may help you lead a healthy lifestyle by promoting body positivity, working on metabolism rather than just weight, and making them feel good about themselves, both mentally and physically, since nutrition is also correlated with psychology. So when you feel good about yourself, the weight program becomes easy because it makes you feel motivated to go on with this new healthy lifestyle that you are going through. My mission as a nutritionist is to guide my clients toward loving themselves, embracing their physical and mental well-being by having trust, friendship, loyalty, and making them feel you're always there for them for motivation. Personally, I would like to say that their goal is my goal. Their satisfaction is my satisfaction. They're not only clients or patients, they eventually turn into family that need guidance for better life. And this is what makes me the most content. So I try to have my clients to love their body, to promote body positivity, work on their well-being rather than just their weight, making them feel good about themselves, because when you are psychologically okay and related to food, your whole life will change and you will be leading a healthy lifestyle. I would love them to embrace themselves both physically and mentally, having them trust their medical professional, trust themselves as well, loving themselves, and be feeling motivated to follow a healthy lifestyle, not only for their body image, as I mentioned. So reaching their goal should be guided through a nutritionist, and they should be trustworthy with their nutritionist as well, because guidance and follow-up is essential and health is very important.
Thank you so much for those positive notes. Thank you for tuning into La Vie Healthy Podcast, where every conversation is a step towards a healthier and happier you.
Thank you so much for having me. It's been a pleasure, and this is a great discussion. I hope it spreads positivity to people out there.